Thank you very much for coming for this briefing on the measles outbreak in Auckland. My name is William Rainger. I'm the Medical Officer of Health at Auckland Regional Public Health Service. With me is Carmel Ellis, who is the General Manager, Integrated Child, Youth and Maternity Services at Counties Manukau DHB. We're just going to give you a very quick overview of the status of the outbreak and the vaccination activity in Counties Manukau, and then hand over to you to answer any of your questions. As of today in Auckland, we have had 804 confirmed cases of measles. That's an increase of 26 from the number on Saturday, and so that's increasing at a constant rate of around 18 to 19 a day, which we've been seeing for the last couple of weeks. The majority of those cases continue to be in Counties Manukau, but there are cases occurring in other parts of Auckland as well. As previously, the age of people mostly affected are children under the age of 5 and young people aged between about 13 and 29. We continue to have a relatively high rate of hospitalisation across Auckland, with some seriously unwell people, but no deaths. I'll pause there and I'll hand over to Carmel to talk about vaccination.
Sure. So we've had a busy weekend. We started our pop-up clinics last week. So Saturday and Sunday we've seen over 300 vaccinations done at the pop-up clinics. We've also heard from our primary care colleagues that they've been extremely busy providing vaccinations within their settings as well. We are also making some decisions as we move along. For example, Clendon was pretty quiet in the morning, so we decided to move staff up to the super clinic, and we were really busy. So we'll continue within the week to make some more announcements about where we will have pop-up clinics this weekend.
Thanks, Carmel. We'll open it up for any questions.
You're dealing currently with the suspected case at the St Peter's College Ball. Can you sort of tell us how many students and staff are potentially at risk or unvaccinated?
I can't tell you the number of potentially at-risk people, but we can get back to you about that. But what I can say is that, as you said, it's a suspected case. It hasn't been confirmed as yet. We would get the blood test result back in the next couple of days, and then we'll work with the school accordingly. Even if people were exposed to a confirmed case, they wouldn't be infectious until this coming weekend. So there's plenty of time to provide advice about quarantine.
We saw obviously school nurses being upskilled. What can you tell me regards the number of vaccinations and sort of vaccination stations in schools this week?
Yeah, so we are starting in Manurewa High tomorrow. The rest of the school nurses who have been trained will be rolling out from the following Monday because they need to get their authorisations done.
Yeah. With the number of people hospitalised, is anyone critical?
Last week there was a child who was very unwell. I'm not aware of the status of that child. I believe they were improving, but as to what other people might be in critical condition, I don't know.
And people in ICU, how are resources coping with the number of people?
I haven't got information from intensive care, but we can get that for you.
So have schools erred in telling students not to go home after this, telling students to go home after this ball?
I think the schools have been proactive in terms of giving their families a heads up, and that's possibly been misinterpreted.
The Prime Minister talked about misinformation yesterday with regards to internet conspiracies, anti-vaxxers and that kind of thing. Is that of a concern to you also?
I think the outbreak in Auckland takes place in the context of a number of outbreaks internationally, and we do know that people's concerns about the safety and effectiveness of MMR is part of what's behind that. So yes, it is concern. People can be very, very assured that MMR is a safe vaccine and it is an effective vaccine. So people should have no qualms about having their children and themselves vaccinated with MMR.
What's your message to those who are putting out the anti-vaccination messages, which are still ongoing?
Measles is a serious illness. A relatively high proportion of people end up in hospital with this illness. We've had experts from Starship talking over the weekend about the frontline implications of particularly children having measles. It's not a trivial illness. It can be fatal. It can leave people with serious and permanent brain injuries, and it can be prevented by MMR. Those are the scientific facts.
Are they being irresponsible by telling parents otherwise?
They are misinformed, and they are misinforming other people.
Should the government change its reimbursement policy to allow pharmacists to administer measles vaccines?
That's not an issue that I can really comment on.
Can you tell us more about, I think there's a Northern Regional Coordination Centre being set up?
Yes. The three DHBs in Metro Auckland, that's Waitemata, Auckland and Counties Manukau, have a process for working together when there's a large-scale event, an emergency or an event like this. And so the Northern Regional Health Coordination Centre is being activated in a virtual sense. So that just will help the DHBs to work together in terms of coordinating their messaging to the public about the importance of vaccination and in terms of vaccine supply and outreach activities such as those that Carmel has been talking about.
And is that in response to any concerns around the messaging that's gone out so far? So we've got all these schools telling please stay home kids and they even have done that.
No, it's really more in terms of a response to increasing the coordination for vaccination outreach through primary care and other mechanisms.
How many schools across Auckland do have confirmed cases?
In the course of this year, there have been 50 plus schools that have had confirmed cases and a similar number of early childhood services, and we have been working very closely with the Ministry of Education to support schools in terms of their response. So as I said the other day, it's a balance between protecting vulnerable people if there has been a case, but also not inadvertently interfering with important events in people's lives, their education and sporting activities.
And a question for Carmel. What can you tell us about the rates of immunisation across the county's Manukau region, and what's your goal with this current campaign?
Sure. So we know we've got really good rates for our younger children. So with the National Immunisation Register, we've got really good data for those younger than 14 years. If we look at our 2-year-old information as well as our 4-year-old, we're well into the 90s. So we know we've got good coverage there. For those kids older, we don't have a centralised register that captures that information, which is why this is a bit of the unknown. That information is either held by parents or within primary care. So we find it really difficult to figure out how many people we need to immunise or how many people aren't fully immunised to have a target.
Are you sure that you've got enough MMR vaccines to fill the gaps?
So the Ministry have assured us at this time we do have enough.
There's a lot of talk at the moment, particularly from older people who say my kids weren't vaccinated, they were fine, they got measles, they went through the disease. Can you talk a little bit about the effects that it could potentially have on kids that are going to school with those children with weakened immune systems and that kind of thing?
Well, I think the first thing to say is that measles is quite a severe illness. So even if you don't end up in hospital or with serious consequences of it, you're away from school for a few days and it's a very unpleasant thing to have. So it's best avoided. The next thing is it does have a rate of more serious consequences. So 1 in 1,000 or so people will have some sort of serious or ongoing consequence from the thing. So most people will have an illness that is unpleasant, interferes with their lives, means parents have to stay away from work, or there are disruptions to daily lives, and some people will have some more serious consequences. The other thing is, it spreads so very easily from person to person. I said the other day that one case of measles might infect another 15 people. So those people in the community, in schools and early childhood centres or places of work who are perhaps vulnerable for one reason or another, they're going to be exposed. They can get the illness and they might have a more severe illness. So there is a social responsibility dimension to this as well.
If it continues to spread at this rate, how likely do you believe it is that someone could die?
The fatality rate is about 1 in 1,000, but that doesn't mean you have to reach 1,000 before someone dies. Someone could die at any time of this. It just means the more numbers, the more likely it is that there will be a fatality.
And what else is up the sleeve for the public health service? What would the next steps possibly be?
Well, we're at the next step really, and that is the population-based intervention to forestall this event or slow it down, reduce its impact, and also, most importantly, prevent it spreading to elsewhere in the country, is to do with vaccination. Hence the activities that Carmel is talking about, and hence the Ministry setting up the National Coordination Centre to push vaccination across the country. You know, it can't be said often enough. Measles is a preventable disease. It is preventable by vaccination. Vaccination is safe.
Would you be in support of a change in schools that meant if you were one of those people that was refusing to get your child vaccinated, that child shouldn't be going to schools?
Personally, I don't think that would be an effective approach. I think it's far more preferable to give people the facts, deal with misinformation, and support people to make the appropriate decision.
And you're still happy with the message of there's no reason to cancel public gatherings when you're now saying that you're having to support schools, provide support to schools after a possible measles exposure, which wouldn't have happened. You wouldn't have to be providing that support if there wasn't that public gathering. So you're still happy that there should be public gatherings going ahead?
Yeah, it's the issue of proportionality, and people should go about their daily lives. This is a large-scale outbreak in Auckland, and it needs to be taken seriously. But life goes on. We talked the other day, and I probably wasn't quite as clear as I needed to be, but potentially the medical officer of health can give instructions, can actually give orders and say that events will be closed down, and we're not going to do that in these circumstances. That would not be proportionate. But once again, the message is very, very simple. Vaccination is the answer to this.
How confident are you that these measures are going to be enough to reverse the trend of increased cases?
Well, I think with good immunisation outreach, with the message getting out about vaccination, there's every chance that in Auckland the rate of increase will slow and we will reach a plateau, and then we'll be on the downside of it. I can't predict when that's going to be. The answer lies with people who are not vaccinated getting vaccinated. I'm also have a degree of confidence that by taking these measures in Auckland and elsewhere in the country, we can prevent the scale of event happening elsewhere in New Zealand.
If these measures don't work, next steps?
The next steps are a more widespread and intensive national immunisation campaign.
What would that involve?
Well, the Ministry is thinking about that at the moment, so they can probably talk about that.
What would be proportionate for the medical officer of health to shut things down if we're not at that proportionate level yet?
And thinking about taking that sort of step, one would think about the number of people affected, the severity of the illness, the stage of the outbreak, and the impact on other parts of the country. So, with a measles outbreak, at this stage of its development in Auckland, with where we're at as a country, I don't think you would take those steps, but it is possible.
How far off are we?
In my view, it's not something that, in terms of giving orders, using legislative powers to instruct events not to take place, I think we are very far from that.
What would your advice be with school ball season and the winter tournament, kids meeting from all over the country? I mean, what's your main advice for those families and children, kids really going into those?
Well, twofold. First of all, be immunised. And secondly, if you think you might be developing measles in the early stages, then it's best to stay away. Now, early symptoms of measles are rather general, but they consist of red, sore eyes, a fever, runny nose, and the typical rash doesn't come on for about 3 or 4 days. So the general message is, if you're sick and you think you might be developing measles, please stay away and protect others, but also get immunised so that you don't have to worry about it.